Have you ever stopped to think about what's really happening behind the scenes in a hospital? Well, today we're going deep inside one of the most critical but invisible battles being waged every single second of every day, the war against germs. We're talking about a fortress of safety, and we're going to find out exactly how it's built.
So, this is how the enemy gets in. These are the ways the fortress can be breached. A single contaminated instrument, a tiny lapse in procedure, maybe some cleaning that wasn't quite perfect. Any of these can lead to a hospital-acquired infection. And that risk is the whole reason the incredible system we're about to break down even exists.
It's a pretty wild challenge, isn't it? I mean, when your enemy is completely invisible, your defenses have to be on a whole other level. They have to be airtight, meticulous, and systematic. So let's get into it. How do they do it?
Okay, here's our battle plan for today. First up, we're going to define the enemy. Then we'll decode the different levels of clean, because it's not as simple as you think. After that, we'll check out the cleaning arsenal itself, and we'll even do a deep dive on the ultimate weapon, the autoclave. And finally, we'll talk about the real heroes, the people who make it all happen. All right, first things first, we have to get our heads around the stakes here. These hospital-acquired infections, they're the whole reason this incredibly complex system exists. They are this constant, lurking danger that makes every single step we're about to cover absolutely, fundamentally critical for keeping patients safe.
Right, so to fight this invisible enemy, you need a really precise language. In a hospital, clean isn't just one thing. Nope, it's a whole spectrum with very specific rules of engagement for every situation.
At the very, very top, the absolute peak, you have sterilization. This is total annihilation. Every single form of microbial life gets wiped out. Think of it like a complete factory reset for a piece of medical equipment. Nothing survives. Not bacteria, not viruses, and, this is the important part, not even their super tough, armored-up versions called spores, which are basically designed to survive anything.
Now, take one step down from that, and you've got disinfection. It's still incredibly powerful, don't get me wrong. It gets rid of most of the harmful stuff, but it's got one key weakness. It can't reliably kill those super resilient bacterial spores. So if sterilization is a factory reset, think of disinfection as just clearing your cache. It's really effective for most problems, but it's not a total 100% wipe.
So, it all comes down to the spore. That's the key. And as you can see here, the big difference is all about where that instrument is going. If it's going to enter sterile body tissue, like in a surgery, you must destroy those spores, no question. But if it's just touching intact skin, the rules are a little different. And that distinction, as small as it sounds, can literally be the difference between life and death.
All right, so now that we've got the lingo down, let's take a look at the actual weapons and tactics hospitals deploy to get the job done. You know, in any battle, strategy is everything. And in this war, the strategy guide is called the Spaulding classification. It's this simple but totally brilliant system that sorts items based on their infection risk. And you can see how the required level climbs. Critical items like surgical tools, they have to be sterilized because they're going inside the body. Semi-critical stuff like endoscopes, they just need high-level disinfection. And non-critical things like a blood pressure cuff on your arm only need low-level. It's all about using the right amount of force for every single situation.
Now, one of our oldest and most powerful weapons against germs is just plain old heat. The undisputed champion is moist heat, in the form of pressurized steam inside a machine called an autoclave. That combination of intense heat and pressure is brutally efficient. It basically cooks microbes from the inside out. But what if you have something that can't get wet, like powders or certain oils? Well, for those, you bring in the dry heat oven. It's a bit slower, kind of like a convection oven, but believe me, it's just as deadly.
And the chemical arsenal, wow, it's just as specialized. You can see right here there's a specific tool for every single job. You've got 70% alcohol for prepping skin. But for a big blood spill, oh, you're going to need the heavy-duty power of chlorine. For those delicate endoscopes we talked about, you turn to something called glutaraldehyde. Each chemical is chosen for its specific target and strength. It's like chemical warfare, but perfectly tailored to the enemy and the terrain.
Okay, let's zoom in on the gold standard, the workhorse, the most common and reliable sterilization tool in any hospital, the autoclave. If you can understand this machine, you can understand the entire fortress of safety. Getting to true sterility is a super meticulous process, and you cannot skip a single step. It all starts with cleaning. You just can't sterilize something that's dirty to begin with. Then everything is packed and loaded just so, to make sure that pressurized steam can hit every nook and cranny.
The cycle itself is this precise dance of pressure, temperature, and time. And it's not over then. You still have to properly dry, cool, and store everything to protect that sterility you just worked so hard to achieve.
So this is the million-dollar question, right? The autoclave runs its cycle, the door opens, and the instruments look exactly the same as when they went in. The enemy is invisible. So how in the world can anyone be absolutely sure that the mission was a success?
Well, you can't just trust the machine, you have to verify, always. And hospitals use a really cool 3-layer system to do this. First, you've got your physical indicators, just looking at the gauges on the machine. Did it hit the right temperature and pressure? Then you've got chemical indicators, like special tape that changes color only when the conditions for sterilization have been met. But the real ultimate proof, well, that comes from the third and final layer.
And here it is. This is the definitive test. What they do is they place these little vials that contain some of the toughest, most heat-resistant bacterial spores on the planet inside the autoclave along with the instruments. After the cycle is done, they take those vials to a lab and try to get the spores to grow. If nothing grows, that is proof positive that the autoclave killed the absolute hardiest microbes known to science. It's the gold standard for a reason. There's no arguing with it.
So we've talked about machines and chemicals and all these processes. But the entire system, this whole fortress, it completely relies on its most important component, the people. The nurses, the technicians, they are the final line of defense. They are the guardians of the sterile field.
And their responsibilities are just immense. It's a whole chain of safety. It starts with something as basic as hand washing, but it goes all the way to double-checking every single detail. They're the ones who make sure an instrument is clean before it even does in the autoclave. They're the ones who check those little chemical indicator strips on every single pack before it's opened. And during a procedure, they guard that sterile field with absolute focus. Every one of these steps is a critical link in the chain that protects the patient.
So, the next time you find yourself in a hospital, just take a moment to remember this incredible, invisible war being waged all around you, for you. It's a pretty amazing example of human ingenuity and just sheer diligence. It really makes you wonder what other complex, hidden systems are out there working 24/7 to protect us in ways we don't even see.